As we all know, students today have many medical conditions that may require intervention during school hours. This presentation is designed to give the Newton Falls school staff important information about providing care to students under your supervision in the event of an emergency. First and foremost, it is vitally important that any and all student health information be kept confidential. Student health information is protected under FERPA as part of the educational record. Only persons with legitimate educational interest as defined in FERPA are permitted to access student health information. So keeping that in mind, staff members will be notified about specific student health concerns of those students under their supervision. This will be done through individual action plans for asthma, bee stings, food allergies, or any other condition that could be potentially life-threatening. Most student health concerns are also accessible through Progress Book by clicking on the red cross beside the student's name. Please make sure to keep all health information in a secure location, but also one that is accessible to substitutes. Examples of serious illness or injury include no breathing or pulse, difficulty breathing, chest pain, back, neck, or head injury, burns to a large area of the body, penetrating injury, injuries to the eye, a prolonged seizure lasting greater than 5 minutes, allergic reactions, hemorrhage, poison ingestion, and heat stroke. If a student under your supervision sustains a serious injury or illness, do not move the student unless the scene is unsafe. Notify the nurse and administrator, and if the student's condition warrants, call the office to activate the emergency response team. Render first aid according to your level of training. Someone will need to notify the parent and guardian, and if the student's condition warrants, call 911. Asthma is the most common chronic illness in our student population. Asthma can be potentially life-threatening, so it is important to be prepared to deal with a student complaining of breathing difficulty. Students are permitted to carry asthma inhalers with parent and physician authorization. If a student under your supervision uses an inhaler, please document the date and time and forward that information to Mrs. Noski. It is very important that you verify that the student's symptoms are relieved before sending the student on. If the symptoms are not relieved, follow the steps on the student's asthma action plan and notify Mrs. Noski. You will receive an asthma action plan for each student having parent and physician authorization to carry an inhaler at school. If you do not have a plan, that student does not have appropriate authorization and should not be carrying or using an inhaler. If this should occur, please contact Mrs. Noski. Asthma symptoms are triggered by various stimuli, including exercise, upper respiratory infections, and weather changes. In the school environment, it is important to avoid the use of asthma triggers in the classroom. Please do not use air fresheners or candles, as those can trigger asthma symptoms in many students. Signs of a severe breathing emergency include audible wheezing, coughing, and altered movements of the chest. More serious symptoms are a blue-gray skin color, usually first noticeable around the mouth and nose, and a decreased level of consciousness. If you observe any of these symptoms, or if the student complains of chest discomfort, have the student use his inhaler. If the condition seems serious, as evidenced by a change in skin color or a decreased level of consciousness, activate the emergency response team by calling the office. Do not send the student to the clinic or office. Remain with the student until his symptoms have been relieved or until other help arrives. In order to provide assistance to a student who has an inhaler, it is important to understand the proper use of an asthma inhaler, We will now watch a video that demonstrates how to use an inhaler.